Okay, the third location is at the greater trochanter, posterior, working right into the side of the glutes, which is actually we're accessing the insertion of the deep six, the lateral rotators. Typically, we know that the piriformis and the gemellus will sandwich that sciatic nerve, and I think it's important to note that all of the 6 lateral rotators contribute to that restriction and cause of the pain that's happening with that sciatic pain. So beginning up high, I'm going to go into the glute medius. Now the bone here sits here, and it is about that large. So I'm just going to sit right on top of that bone, and I'm going to go with fibers of the tendinous portion of these muscles that come in and insert into the femur head, the greater trochanter. And I'm just using my fingertips, and I'm pressing onto the greater trochanter, and then I'm pressing in and then going with fibers. There's even a little bit of a clunking that you can probably see, and I want to stay in with that a little bit more and not create much clunk, but hold the restriction and let it let go. And so continue with that, going with fibers, and then I start to sort of fan around, and I'm going to move towards my right and meet where the piriformis and gemellus come in, and I'm kind of at the medial side of this greater trochanter here, pressing into the bone and then going with fibers, and sort of I guess you could call it a scooping, but I'm just using all my fingertips right around that greater trochanter, working with the fibers that come in and insert into that bone. And then I'm going to go a little bit lower to where I'm getting to the obturator, and in going towards the quad femoris. So at the bottom of that greater trochanter head, I'm going with the fibers again to increase mobility, to decrease the fascial restriction that's right there on that bone. And then to go around it, I would just sort of imagining that this bone here, I'm just going to take my fingertips and go right around that head and sort of clean off cross fiber around that femur head. And then on to the 4th location, which is at the ischial tuberosity. The hamstring originates here. I can hold at this point right at that origin, right where the attachment is. And I can either work around the tissue fibers against the ischial tuberosity, or I can also take the leg and move it medially and laterally. And you'll see that the mobility increases with each time I do a medial and lateral movement with the leg. The other 2 sites right here at this location is the quad femoris, which is this nice little square muscle that attaches to the ischial tuberosity posteriorly to the medial side of the femur. And in that place, I would drop my elbow into right here. It's the most effective way to get the result that I'm looking for, to get the release.